And at that time, Chief Unero voiced the frustration about there was no acute care facility in Onslow County, let alone Carteret or Craven. And he said that y'all were working on it, and you have executed. And so I'm very impressed. I want to tell y'all some of the work we've been doing in the year and a half or however long ago it was that I was here, so you can understand what steps, what progress we've made. And fighting this crisis is going to be, it's a long-term effort. It isn't a light switch, let's make this problem go away. It grew a crisis over a 20-year period of time, and it's going to take time to solve it. And we have to be cognizant of that. So some steps that we've taken in our effort to try to make sure that we have a comprehensive approach that focuses on prevention, treatment and recovery, and enforcement. On the prevention side, with Chief Unero's help, the legislature in 2017 passed the STOP Act. STOP Act exists to reduce overprescribing, which leads to addiction and overdose. It does it in 3 ways. Medical prescribers now have to consult a database, the CSRS database, when they write a prescription, so they can see if the patient is doctor shopping, because then you have a different conversation with that patient. It's not about what your back pain is, it's about your drug dependence. Second is it requires doctors to use e-prescribing when they write these scripts, so we can eliminate prescription pad forgeries and theft. And then the third is it sets a limit of 5 days or 7 days for post-surgical of the number of days opioid pills can be prescribed for acute pain as distinct from chronic pain. And I want to draw that distinction because when you go in for your wisdom teeth or a broken arm and you're opioid naive, having a limit makes sense. There are some patients who have chronic pain for whom the limit does not make sense. And doctors have the freedom to do that under this law. In terms of the importance of reducing overprescribing, it was actually at that roundtable we had here in Jacksonville that, I don't know if you remember, there was a man who had been in a motorcycle accident, and he busted his knee and went to the doctor, and he said that within 5 days of getting his prescription, he knew he was gone. And he said 12 years he lived as somebody with addiction on the streets in Wilmington, living a personal hell. And he was fortunately, he's now in recovery, and he was volunteering, working at a treatment facility. But these pills are so addictive. For 20% of patients who are opioid naive, if they take them for 10 days, 20% of them, 1 of 5, will be taking them 12 months later. That's how they just come in and grab a hold of you. They put their hook in you and take over control of your life. For others, it's not that first prescription. It's instead somebody gets prescribed a lot of pills, they put it in their medicine cabinet, and then young people and people with addiction get their hands on them. And in fact, the majority of young people who misuse the pills, they get them from friends and family, not from the doctor. And so that underscores the importance of throwing away unnecessary or leftover pills, or if you need these pills, locking them up so that they don't fall into the wrong hands. Another major element of our prevention effort, in fact, we just unveiled this last week, and I'm pleased that the City of Jacksonville Department of Public Safety is already a partner of this campaign. It's the More Powerful NC campaign. You're going to start to see the commercials on television, on the internet. They're going to be on billboards. Has any of you seen the TV commercial yet on TV? I was working out of the gym, made me very happy to see it on the TV. And this is a partnership with Department of Health and Human Services, Secretary Mandy Cohen, and my department, the Department of Justice, and then a whole bunch of other partners, Blue Cross Blue Shield, Atrium Health are the primary ones, but we've also got the Commissioner of Insurance, Superintendent of Public Instruction, and it's all about giving people the tools, the information they need to protect themselves and their loved ones. We have an excellent website, morepowerfulnc.org, and you can get the facts on this crisis. You can learn how to get involved, and that's involved as an individual. There's a pledge form of what you can do as an individual, but also what you can do as a community, and that's what you all have demonstrated here, that you are getting involved as a community. And then the third is if you're struggling with addiction, how to get help. And now families who have loved ones with this terrible, terrible disease now have a facility here that can help them. That's the second part of our strategy is treatment, because as you all know, we're not doing a good job. I mean, we're just not. This facility is an important step forward, but it's not enough, and you all know it's not enough, because we need more places for people. You have to hand them off to folks, and if they don't have health insurance, it's very hard for them to get that ongoing care and the medication that they need and the counseling that they need. And that really underscores the importance of expanding Medicaid, accepting the federal government's offer to return the taxpayer dollars we send to the federal government to come back in the form of health insurance. We're one of like a dozen states that haven't done it. All these other states have. And this is not a Democratic or Republican thing. It doesn't need to be. And in fact, I was just at a big panel. I don't know if any of y'all came up for Rural Day in Raleigh 2 weeks ago, but Governor John Kasich of Ohio was there. And he's a Republican, and he helped his state expand Medicaid. City of Dayton, Ohio, in 1 year, saw a reduction in overdose deaths by 54% after they expanded Medicaid. Because when people need to go to that treatment, you were just telling me that this new facility here is now accepting Medicaid. That's wonderful if you have Medicaid. But we need to have people have health insurance, because if you don't have health insurance, you can't pay for medical care. 1 out of 6 people with opioid misuse disorder last year got treatment. That means 85% of them didn't. And we can do better, we must do better, and you all are doing better, and I thank you.